This is Healthcare Now Radio's Interviews Now. Thanks for joining us. I'm Roberta Mullin, today's host, joining you from Atlanta, Georgia. Follow our show's hashtag, InterviewsNOW, and join the conversation. In this fast-paced, ever-changing landscape we call healthcare delivery, who can we trust to tell us, good or bad, what is happening now? Let us help you sort out these issues with today's thought leaders in the know. On this episode, we will be discussing healthcare consolidation and the IT impact with Zack Tisch, Consulting Services Executive at Pivot Point Consulting. Hi, Zack. Thanks for joining me today.
Hi, thanks, Roberta. I'm very happy to be here.
I always like to start by learning more about our guests. I have read a little bit about you, and I'd like you to tell our audience a little bit about you. Now, you've come from Duke to Epic to quite a little resume in your history here. So how does one go from Duke to a neuroscientist, medical study to health IT?
Yeah, no, it's certainly been an interesting path and absolutely not one that was planned by any stretch of the imagination. And I think it's interesting. I think a lot of us in healthcare IT have maybe sort of stumbled into this field accidentally and, have really both enjoyed the challenges that are brought to bear and also some of the rewards, obviously, that it can bring. So for me, the journey, I think, initially started even, kind of early on in my education. And, I think I was part of the generation that kind of grew up with that transition to computers and, starting to see that get, introduced in middle school and high school and certainly leveraged a lot more in my studies at Duke. And being able to see firsthand just the pace and speed of innovation and the power that technology can help enable in so many different areas. And so, one of the things, quite honestly, was I think like many students going through college didn't exactly know, what field I maybe wanted to go into and, dabbled in a number of different areas. And I think just that sort of taking a broad view, in some cases, computer science, a lot of philosophy work, did some neuroscience and biology work, as you mentioned. And I think really just having the chance to see some of those intersections was what got me excited about healthcare in general and ultimately the IT slant and being able to, enable a better healthcare environment for all of us through some of that cool and innovative technology that was being developed.
And I also have seen on some of your resume that you've worked in some great hospitals or with some great hospitals, St. Jude, MD Anderson, Atlanta Children's, Arizona. Is that correct?
Yeah, no, I've been blessed to work with a lot of great organizations, and so kind of started my journey in healthcare IT after my undergrad at Duke, where I was recruited by Epic, the nation's leading EMR provider. And at that time they were certainly much smaller than they are now. They were kind of the up-and-comer. They had just signed the deal with Kaiser at that point and were starting to get into that implementation. So they were really growing like gangbusters, and a lot of people were starting to really say, who are these Epic guys, and what are they doing down there in Madison? And so when they came to me and told me a little bit about what they had going on, some of the great organizations that they were working with, I really just got excited and motivated about the chance to join the team there and spend a great 6 years really getting to see EMR implementations from the vendor side and work with and support their customers, and a lot of great organizations like Children's Healthcare of Atlanta and many other pediatric organizations, as well as some really wonderful large academic medical networks and integrated IDNs.
Yeah, those are great hospitals. So now you're with Pivot Point Consulting. Tell us a little bit about Pivot Point Consulting and the role it plays in health IT.
Absolutely. So Pivot Point Consulting is about 300 consultants. We're a national consulting practice, and we really focus at the end of the day on helping our clients to achieve the goals of their healthcare institutions, and often it's through the lens of technology. And that can take us down a number of different paths. And some organizations, they may be, maybe earlier on in the journey and really need to develop that integrated electronic medical platform and base to be able to grow their institution from. Other organizations maybe have, made extremely large EMR investments, multiple $100 million projects, but Over time, functionality and system tools change, workflows and best practices change, and you also get folks that maybe work around different processes or, have fallen away from some of those standards. And so we're often brought in to maybe help reinvigorate and re-energize the EMR, do some optimization work looking not only at the system, but also at overall best practice operational processes. And, ultimately at the end of the day, doing what we can to help our partners achieve their mission in healthcare, which is to take better care of their patients that they serve in the community, to do a better job doing that than they are today, and continually advancing that quality mission forward, and to be able to hopefully serve more patients at a lower cost. And that's really led us, I think, down a number of interesting journeys with our customers and helping them to get the most value ultimately out of their EMR assessment or out of their EMR investment, and then also teach them how to continue to operate in that fashion to, come in, do a demonstration project, measure it in a scientific way, and then roll out those successes across your organization to take advantage of those benefits, and then continue to do that over time. I think one of the great things about an EMR versus the paper world is these products are continuing to evolve and grow as the industry evolves and grows and the vendors push that functionality forward. So it's a little bit of a different mindset and culture shift, and I think that's often part of one of the more rewarding pieces of this work is helping organizations through that journey.
What are the type and sizes of the organizations that Pivot Point helps your clients?
It's interesting in that it's really from, some of the very largest and world-leading organizations like Stanford and Cleveland Clinic, University of Virginia, MD Anderson Cancer Center, who we mentioned, and then kind of all the way up and down the spectrum. So lots of community hospitals, doing a lot of work with critical access hospitals, also quite a bit with federally qualified healthcare centers, FQHC organizations, and safety net organizations. And I think one of the things that we really try to pride ourselves on is advancing the industry forward and being able to help organizations of different sizes and budgets and complexities with their goals. And, whether it's a strategic advisor with 20 years experience that you need, maybe an hour or two a week here and there to help with some of your 5-year plan and goal planning for the organization, or it's a team of 50 people to come in and deliver a large project like building out and deploying a brand new hospital facility. And I think that's part of what keeps the work so exciting and interesting for us, as well as being able to align ourselves with our customers and serve so many different needs as they're out there trying to grow their organizations and do a better job with the patients they serve.
That's great. So over the past decade, we have seen consolidation, mergers, acquisitions in the healthcare systems. And I don't think we're slowing down, and I think it's going to continue, don't you?
Absolutely, and that probably accounts for, in some form or fashion, somewhere between a third and half of the work that we're doing currently in helping our clients with, particularly on the kind of more the strategy side. So as we've seen, certainly going back to meaningful use in the HITECH Act and just some of the legislation and push around getting electronic medical records in place, as those foundations were established over the years, I think organizations have looked to say, how can we take advantage of that integration and investment and platform that we have? And just as they're seeing, their community providers that may have historically been independent but are coming into the hospital to provide services and using the EMR in that venue, there's sort of a natural progression of, hey, can I get access to these same tools in my clinic? We're seeing the same patients. We're providing a very integrated care experience. Can we leverage the technology to help us do that in a better way? And then certainly as you look to value-based care and more population health models that we're just moving to as an industry over time, I think that also aligns itself with using technology and finding ways to better integrate the delivery model, whether it's through a kind of a true merger and acquisition. We're also seeing quite a few joint ventures, even between organizations that maybe historically were competitors. And then also seeing sort of a third category where many healthcare institutions, particularly your larger ones that have made a big EMR investment in a large platform like an Epic, have the kind of the data center and infrastructure piece already there and have a wonderful team supporting those tools, or actually extending those EMRs out to community hospitals, critical access hospitals, and unaffiliated providers in the community is more of a software as a service or vendor model. And certainly seeing the vendors start to push that as well. So absolutely, that is a large part of what's going on in the industry right now, and certainly generating a lot of the opportunities that are out there.
So that's what's driving most of these, the change in value-based care, the reimbursements, the innovation and the technology. That's kind of what's driving these.
I think there's a number of drivers. That's certainly one of the big ones. I think just kind of payer and reimbursement changes in general are also squeezing a lot of segments of the market where in many environments it's pretty difficult to still be successful as an independent or small physician group, particularly if you have some large hub organizations around you. So I think naturally those groups are starting to look at, where do I need to maybe align myself with one of the organizations in the community that might be offering, whether it's more of an affiliation opportunity or to join up with their medical group. But then we're also seeing too, I think, the progression of some of those groups that maybe did go it on their own as meaningful use and the HITECH Act was coming out, made that investment in an EMR platform, and now are a few years down the line and maybe are looking for a newer, better, faster system, or maybe weren't happy with the investment or direction that they went in and are looking to realign at that point. And now that organizations are kind of getting to the end of their value on those investments or contracts are starting to come up, people are now, instead of just renewing, saying, well, let me look at all of my opportunities in the marketplace, and that might be, to be acquired, that might be to partner with somebody, that might be to join up maybe with some other like-minded and like-sized organizations in a joint venture. And so it's certainly driving a lot of interesting conversations, and one of the things that I love about that too is not just the opportunities for technology alignment, but also operational alignment, and where can we save cost, be more efficient, not repeat work, and ultimately make a better, more efficient patient experience.
Well, you can never say enough about workflow.
Absolutely.
So what are the biggest IT challenges organizations are tackling as a result of these consolidations?
I think one that's really a challenge, especially with a true acquisition, is how much does the host organization make the organization that they're acquiring like them? And from a technology perspective, a lot of times we start with, okay, let's look at maybe the core EMR platform, and certainly that's something to make sense to integrate and to integrate early. And then you start to look at maybe more of the ancillary areas. Well, ideally we'd have alignment on the lab systems, because then we could maybe utilize the larger hub as kind of a reference lab and reduce some of our costs locally, maybe increase turnaround time, and just provide an overall better lab catalog and experience for our patients. Well, that certainly would make some sense to do, but if we need to do that, that's a pretty big project. Maybe they have a couple of years on their existing contract that are now kind of wasted costs or money that they would need to buy out with that vendor. And so as you start to chase some of these things down, I think what we spend a lot of our time with our organizations with is, here's all the things that you could do and what integration could mean. At the very lowest level, it might just be, we're branding together, and we're going to put our name on your sign and update our colors and marketing, and you're part of the family now, and maybe kind of sharing some funding, but you still are very much running and operating as an independent organization with your own policies and systems, versus the kind of complete other direction where we're going to come in, replicate our care model, our exact kind of staffing and service lines. And then on the technology side, things like making sure that the networks are exactly the same, that we have the exact same printers and computers and peripheral devices and barcode scanners and Pyxis machines, and the list sort of goes on. And so you can, take the same project to maybe integrate a 100-bed community hospital and take that budget anywhere from maybe $1 million or $2 million on the low end to do sort of that minimal integration to maybe 20, 30, 40 on the high end to really, kind of make them identical and have that full ability to integrate and share services. And for most organizations, the right path is going to be somewhere in the middle of that. And I think it's really important to kind of scope that out in advance, both with the host organization and the organization that's being acquired, so everybody's clear about kind of who's getting what, when, and what that cost looks like. And typically that transition plan may be a 3 or 5 year plan once you map out kind of all these different systems, and then start to get into really the purely operational things like drug purchasing, and where do we buy linens and food services for cafeteria, and all the other areas where, now that we're part of a bigger organization, we might be able to share some savings and take advantage of those contracts.
So that sounds like all those things that you just talked about, especially on the IT side, minus the linens and the food, are things that these health organizations should be considering in the planning stages of all of this.
Absolutely, and one of the things that we do is we have a kind of what we call our pre-implementation planning playbook approach, and have a kind of a very detailed point-by-point plan for each of these areas, whether it's IT infrastructure, legal, HR, sort of across the board. What are some of these considerations that are important as part of that sort of initial due diligence process? And it's, I think it's easy to get people excited about the, let's share an EMR and share patient data, and absolutely that makes sense and is the goal. But I think it's also important to kind of get into the specific tactics of when we say that, what does that really mean? And being clear about scope, about third-party interfaces, what data is going to live where, and where some of these operational services, may align over time.
If you're just joining us, this is Interviews Now, and I'm talking to Zack Tisch from Pivot Point Consulting about healthcare consolidation and the IT impact. So back to, how are healthcare organizations addressing data sharing and migration needs during a consolidation?
That's absolutely something that I think is very front of mind with these discussions, and certainly one of the reasons that a lot of these mergers and acquisitions happen are for the ability to then get those providers into the same charts and kind of shared clinical ecosystem. And so as part of that, there's always the question of, well, what do we do with the legacy data, first of all, that may be coming from a separate system? And so usually we like to start with really what are our technical opportunities and capabilities there, and that's going to vary system by system. And then once we have a sense of kind of what we can get out in what format and level of quality and detail and discreteness versus, maybe more free text data, then we'll usually look at kind of what's the cost to value, and try to segment the data into a couple of areas, with the most important being what's really used for for patient care. And that's typically going to be, your medications, allergies, problem list, maybe your provider notes, imaging and other procedural results. Then usually we have kind of a second category, and that may be things that just we legally need to maintain, for audit purposes or legal investigation purposes. And so we need the data, and it needs to be accessible, but it doesn't necessarily need to be actionable right away. And so you might be able to put that in maybe a separate system that's a little bit lower cost, maybe not directly in the EMR, but linked to it, and being able to sort of manage your utilization of data and the cost to support that data and convert it over. And then lastly, the third bucket I kind of look at is, what data can we almost use as kind of an opportunity to train the providers and staff as we move to the new project. And so even if we can convert certain types of data, and often do, we often like to hold some of it back and use it as really a very realistic training opportunity for RNs, MAs, and their providers, for example, to come in and take some real charts and abstract some of their real patient visits into the new system. I've always found that the more realistic you can make the training, the better. So if they're working in their new system, with patients they know and charts that they've entered themselves into their legacy system, that's really the most realistic experience you can give them, before they have a patient truly in front of them. And so often we try to build part of the conversion really into the training and provider and staff readiness part of the go live and conversion project as well. I'd say overall it's usually an area where organizations have to be thoughtful about their investment. Ideally, you would just always convert all of it discretely, but it can often be, very time consuming and expensive to do that. And you often have to make some judgment calls on what of that data is going to be most useful, and then also obviously making sure that you still maintain access to it for patient safety or regulatory needs.
It's amazing how many legacy systems, and when I say legacy, some of the oldest ones that have been sunsetted by vendors that are still being used out there in hospitals, correct?
No, absolutely. And I think that's maybe one of the, sort of sad secrets of healthcare a little bit is that some of these wonderful organizations that are, it almost makes you tip your hat to them even more of the amazing and safe and high quality patient care that they're able to deliver with some of the systems that they still have to work with and support. And, we still work with organizations that have green screen and DOS systems that are being replaced that have been out of support for 20 years and that, are a real risk point that if system X crashes, we don't know if we're going to be able to bring that system back up. And so often we're, really trying to identify where are those risk and failure points and making sure that we remediate those things immediately. And that's actually often a really important part of the due diligence of these mergers and acquisitions. Many organizations that are being acquired, part of why they may be open to being acquired is that they haven't always had that financial support. And if you haven't had that funding, you likely have some IT systems and equipment that are a little bit older that maybe have less staff that have been able to support and maintain them, maybe some higher turnover and brain drain from the organization. And so it's really important to come in, do an assessment of everything that's there, how is it being used, and making sure that we have a good plan for it moving forward to either migrate them to a different, more functional tool or to shore up the current concern.
It sounds like a real opportunity when you get into all this planning stages that because people should be getting off these legacy systems. So it really sounds like a good opportunity for these systems to be completely sunsetted.
No, absolutely it is. And I think, again, what's, one of the better things about these mergers and acquisition projects, but also probably one of the bigger challenges for the health systems that are going through them is just there is so much you can do. And you can often, find so many ways that you can improve their ecosystem through, new tools, better integrated tools, maybe shared analytics platforms. And so often I think one of the bigger challenges is what do you say no to or what do you maybe scope out as a future post-live optimization. We have a lot of organizations that have a lot of great ideas and certainly a lot of capability, but there's often, much more work than can be achieved. And so we try to work with our customers to be thoughtful about what are really the kind of core pieces that are part of that initial transition. Let's make sure that we get them up on those shared enterprise platforms successfully. And then once they're kind of back to stability again and hopefully seeing some, improvements in patient care, improvements in rev cycle and some of the other benefits that you would get from maybe coming to a more fully featured EMR system. And from there have kind of a more of a roadmap for ongoing optimization and process improvement. And, don't try to necessarily do everything day one, even though there would certainly be value in doing so. And sometimes you have to make hard choices about what those projects should be.
So we just have a couple minutes left here, believe it or not, but I want you to leave us with some best practices that you would recommend to health organizations to make these transitions as seamless as possible.
I would say first and foremost is having a good shared understanding and discussion across your internal leadership team before you start engaging potential partners, whether it's an acquisition or more of a software as a service deployment. We often see this happen a little bit backwards where, maybe some of the strategy or provider community relations folks that are often doing this work in the community, talking to potential partner organizations, that can generate a lot of excitement and interest, and then you kind of have to take the step back and say, okay, what are even the offerings that are available? And sometimes we go, 6 months to a year with an organization that has an integrated partner, but haven't then figured out what they want to offer, what they would price that offering at, or who would share what components of the cost, and when could they possibly do it on the timeline with some of their other IT projects that they already have. So we really like to do workshopping with the senior leadership team and say, okay, if mergers and acquisitions are part of our growth platform, let's talk through some different profiles of deals that we would do or wouldn't do. Let's start to put some more parameters and guiding principles around it and have some more shared understanding about what we think we can deliver as an organization and what that cost would be. And certainly some organizations get into the scenario that's overall good but tough to manage, where you maybe have 5 or 10 interested partners and now you're trying to figure out we'd love to integrate with all these folks, but how can we possibly do this in a timely manner? And that's where I think the more that you can talk about that ahead of time, what are our priorities here? What do we hope to achieve? How do we want to do shared governance between the partner and the host organization? And really having clear discussions internally and then having those same clear discussions with your potential partners. The more I think of that due diligence you can do up front, it's going to make the actual integration that much smoother and really lets you focus on the technical and change management work of bringing the organizations together.
Those are some great final thoughts, Zach. I really want to thank you for joining me today.
Absolutely. Thank you so much, Roberta. I really appreciate the time. And, absolutely anybody that's interested in chatting more about these areas or that could, use some advice or assistance would always love to help out, other folks in the industry. So do not hesitate to reach out. And again, thank you for the opportunity to speak with your listeners.
You can learn more about Pivot Point Consulting at pivotpointconsulting.com and follow them on Twitter at PivotPC. And thank you for joining us today. For more information about Interviews Now, visit our show's program page on healthcarenowradio.com. And until next time, if it's happening in healthcare and it's now, it's on Interviews Now.